actually came to me and asked if he could introduce Congressman Bucshon. So, floor is yours, Joey.
Well, I really have the pleasure of introducing my boss, Congressman Larry Bucshon. He has served this district honorably since 2010 now, and I hope everyone's excited to hear from him as I am. Congressman Larry Bucshon.
It's on. What are you doing?
Well, thank you all. It's great to be here. Thanks for that rousing introduction, Joe. I appreciate it. Thank God. And I don't feel as much like I beat my head against the wall as I did during the previous administration. I can just tell you that the left are doing everything they can to divert the attention from what the Trump administration is actually doing. I think they've gotten off, from behind the scenes pretty strong. And the place I direct you is on the regulatory climate, the so-called fourth branch of government, the executive branch agencies, and see the people that he has appointed to his cabinet and what those people are already doing in the executive branch agencies to basically get them back within the rails of what they're supposed to be doing in the regulatory area. We've also passed what are called Congressional Review Act legislation in the House and Senate. The President signed it to directly overturn regulations that the previous administration put in within the last 60 legislative days. Some of those were big. The first one we did was it was misnamed. It was called the Stream Protection Act, but actually it was shut down the coal industry in the country forever act. And we were able to overturn it. That is a big deal for the 8th District of Indiana. Every coal mine in the state is in my congressional district. It would have put 65% of their coal reserves almost permanently out of touch, out of reach. And things like that. Look at my website, you'll see the other ones we've done, and we'll continue to look at that. But the Trump administration, in contrast to what you're seeing on TV, I think, it's getting off to a pretty good start. And just look, we confirmed Neil Gorsuch to the Supreme Court, and thankfully Senator McConnell and his team over there in the Senate did what they had to do to get done. Against the first ever filibuster of a Supreme Court nominee in U.S. history. And I think our friends on the other side made a big mistake doing that. And I'm looking forward to 2 or 3 more conservative Supreme Court justices during President Trump's administration. And this will really put us in a good place from a conservative perspective for decades. This is really important. And so they're getting off to a good start there. The people that they've appointed, Jeff Sessions, over at Justice, border crossings and people having to be deported are way down and 5-year low already after the first few months of this administration. They've made it clear, not only on that issue but many others, that the rule of law does reign again. Thank goodness, because we had problems with that in the previous administration, ignoring the laws of our land. And if anything, that we are in this country is a country that lives by the rule of law that sets us apart from a lot of other countries around the world. So we're getting off to a really good start. Congress is getting off to a little bit of a slower start in some areas, and I'll just touch briefly on health care. Look, I was with the President on the health care legislation in the House. I was with the President, Vice President, Secretary Price. And, it was a process which is a little confusing to the American people. It's called reconciliation, where we have to address this under reconciliation process, the budget reconciliation, because in the Senate we don't have 60 votes. And as you know, the Democrats are not going to vote to overturn the health care law, the Affordable Care Act, or any part of it. So we were restricted in the House on what parts of the law we could immediately address under this process, and have only 50 votes in the House. And it has to have a direct budget impact. We had everything in the Affordable Care Act that had a direct budget impact in this to overturn the Affordable Care Act, that had any part of it that had that. But we had a group of our colleagues who, again, were saying, well, it doesn't go far enough. I agree. But it doesn't do me any good now to pass something in the House of Representatives that I know is not going to become law. And I'm just here to tell you that's my position on your behalf. We want to make headway and get things to become law. And I think we may still get there. We'll see next week when we come back on health care. Let me just tell you what was in there. Repeal $1 trillion in taxes over the next 10 years. All the Obamacare taxes repealed in our legislation. Reforming the Medicaid program since the first time since its inception, in a way that allows the state of Indiana to continue Healthy Indiana Plan 2.0. In fact, gives us more flexibility to make sure that programs like that across the country can be successful, be fiscally responsible, but also provide a service to the people that need it the most. That's in there. So just those two things alone. Repealing all kinds of other things in the law that are putting a hamper on the healthcare industry, the insurance industry particularly. I'm not here to defend insurance companies, but the Affordable Care Act puts some things in the law that make it almost impossible for insurance companies to keep premiums down. And that, because that wasn't the intent, right? The intent of the thing is to make the whole thing crash, and so we have Sanders up there promoting a single payer, right? So these are things, in my view, were somewhat intentional. So there's a lot of stuff in there. Just keep watching. We'll see what happens next week. We have to get this done though, because to do tax reform in the way that we want to do it, we have to have that $1 trillion in taxes in the healthcare law repealed. You may have seen President Trump talking about that this past week, and that's true. There was no dispute amongst Congress and the White House on what to go after first. The media wanted to create that narrative. Well, the president wasn't happy we didn't do taxes first, and we're doing health care first, and that was this and that. That's not true. There's a lot of communication on a daily and hourly basis between what we're trying to do in Congress and this new administration to make sure that we're in lockstep so that we can move forward on behalf of the American people. The stuff you're seeing in the news media about that is they're trying to create this narrative that that's not true. I'm just here to tell you, I'm there every day. I know it's not true. We're working with everybody to move a conservative agenda forward. That's what the American people voted for. Earlier part of, what is today now, Monday. Last week, I was in California. I went to Silicon Valley because my committee has jurisdiction over the tech industry. And I can tell you, being out there on the left coast, that they literally still do not get why we have President Trump. And we tried to explain to them about middle America and the heartland of America here in Indiana and other states. And you know what? That's good that they don't get it. That's good. But what we have to do as a party is take this opportunity and deliver. And so I'm disappointed about the health care that we didn't vote on the health care law, because I intend to do what I've said for the last 7 years, to replace this law in a way that gives people actually access to low-cost health care, and do it in a way that the American people want and the American people need. So with that, I'll take some questions. I think we're not as far apart also amongst House Republicans as the news media. The Freedom Caucus guys, I know them all. They're all friends. Mark Meadows, the leader of that. I went and talked to him one-on-one about health care when we were trying to get this thing worked out. It's just it's just a process issue of getting through the process. The other thing, last thing I'll say on health care is Tom Price, the Secretary of Health and Human Services, is a personal friend of mine. He helped campaign for me on my first campaign. He's a physician. He's part of the Doctor's Caucus. My group, our group, the Doctor's Caucus, has already been to Health and Human Services to talk to Dr. Price. The Affordable Care Act had over 1,400 places in it that it said the Secretary shall and will. Well, he is going to shall and he is going to will things differently than the previous Secretary of Health and Human Services. I can tell you that right now. Well, many of those were just guidances from the agency that can be overturned with the stroke of a pen. Him and his team are going through everything in the Affordable Care Act to make steps in a positive direction on behalf of the American people. That is a big piece of what we're doing, and thank God that we have Dr. Tom Price from Georgia as our secretary. So with that, I'll take some questions. Yes, sir.
Hey, Larry, tell us about the age rating with the insurance companies.
Yeah. The age rating.
I have a lawyer. They can charge me 3 times is what they charge her.
Yeah. Here's what the age.
Go ahead.
It's a complicated. It's complicated, but here's the situation. That's one of the what I would call non-actuarially sound things that the Affordable Care Act did. It has to do with this is all pre-Medicare. So anybody on Medicare, this is not applicable to you. Okay, this is pre-Medicare people. Before the Affordable Care Act, across the country, the average difference in medical expenditures for, say, a 64-year-old person and a 21-year-old person, the difference is about 4.8 times as much healthcare expenditures for a 64-year-old as a 21-year-old. That makes sense, right? And so the insurance companies, and again, I'm not saying we go back the way we were before, but what happened is you know, that is about how the premiums turned out too across the country. That was a factor, right? Not the only factor, but a factor that it could come. I mean, if you're running a business and you're going to pay out 5 times as much for a certain group, it makes sense that you can't charge the same rate as you would for the other. So what happened is the Affordable Care Act said, well, we're going to just set this nationwide at 3 to 1.
3 to 1.
3 to 1, okay? And here's what happened, okay? They say this is 21-year-old, this is a 64-year-old person, okay? What they thought would happen is that the companies would take the 64-year-old premiums and move it down here, right? 5 to 1 average across the country, down to 3 to 1. So the premium would drop. For the premise is that they were going to fix this at the federal level, a federal mandate, and the premium would drop down for the 64-year-old. Well, guess what actually happened? Okay.
Well, that was what it was. They was charging
Right.
sometime before the law, they was charging 10 times as much.
Actually, that's not.
And then-
Actually, that's not
Oh,
true.
it's
The average was 4.8 to 1. The average.
Is there
The expenditures and the
Congress
thing.
now to do it 5 to 1?
Let me finish.
Okay.
Let me finish. Okay? This is one that, depending on your age, you may agree or disagree with. But you have to understand that if we don't do the right thing, it affects everybody. So that's what I'm getting at. So you had 21-year-old, 64-year-old. Again, if you're on Medicare, this is not applicable to you. They thought, the Affordable Care people thought the premium for the older person would drop because it's going from an average of 4.8 to 1. The expenditures for health care, the average is 4.8 to 1, so that's basically kind of where the premiums were. And what actually happened is this. The companies go, well, that's fine. What we're going to do is we're going to move the premium for the 21-year-old over here. Okay? And then the premium for the 64-year-old is going to go up just a little bit. So there's your 3 to 1 ratio, right? It didn't go from the 64-year-old didn't drop. The 21-year-old's premiums they raised up to here so they could meet this 3 to 1. It's not an actuarially sound principle. It just doesn't work. So what happened is this: the 21-year-olds are getting priced out of the marketplace. And that's why the Affordable Care Act said 40% of people in the exchanges are going to be 35 years old or younger, okay? The actual number is about 28%. What actually happened is about 28 to 30% of the people in the exchanges are 35 and younger, the younger, so-called younger and healthier people. So when you price all those people out of the market and they've chosen not to pay the penalty or just not have insurance, okay, because their price went from here over to here because of this age band rating thing, what that does then is the whole risk pool is skewed older and sicker. Does that make sense? Because all those people don't sign up. And so what does that do? That increases, that's why the premiums are going up 25%. In some states they're going up 100 and some percent because the insurance companies are losing so much money that they're just dramatically raising everybody's rates to make that up. So what you have to do, and again, this is just one factor, right? But it's an important one. And the reason I know so much about this is because I'm on the committee of jurisdiction with my legislation to give the states the flexibility, essentially, to set the age rating which based on the actual expenditures in their state.
But is there a proposal in Congress now to raise it to 5 to 1?
That's what, there's a baseline of 5 to 1, but then the law, what the bill says, and I did this, what the bill says is it can be 5 to 1, but a state can make it 1 to 1 if they want, or 2 to 1, or 3 to 1. See, here's the problem. It seems like, right? It seems like that's a bad idea. I mean, I can get that you think it's a bad idea doing that, the 5 to 1.
Well, it looks like you're taking it out the older people and putting it in the pockets of the insurance company.
No.
I mean, if you're charging somebody, if
But
they're charging me $200,
But their health care expenditures are 5 times as much.
5 times would be $1,000.
No, what it is actually you're taking money and you're taking money from younger people and shifting it to older people. That's why they won't sign up. So what has happened is this, okay? If you allow that to change, the cost for the older people is not going to go dramatically up. Because what's going to happen is you're going to get the price is down, and you're going to get more people age 35 and under into the marketplace. And when you do that, it changes it makes the risk pool less risky. And so everybody's costs come down. But you can see how complicated of a explanation it is, right? When AARP just comes out and says it's an age tax, which is their message, right? They're against it. But if you don't do some of these things that were in the affordable, that's what it means to repeal the Affordable Care Act. Because it's not only that they did all kinds of other things that make it impossible for companies to stay in the market. See what I'm saying? But you're on Medicare, I'm sure, so it wouldn't affect you anyway.
I just wanted to question how on the floor.
See, this is why it's difficult to repeal. Let me just say this. This is why it's difficult to repeal the Affordable Care Act. Because you're one of the most conservative guys I think I probably know. And you're saying we shouldn't do it.
You agree with it?
See what's that?
You agree with the 5 to 1 instead of the 3?
Yes, I do.
You agree with it?
I agree with whatever the state says is a proper, actuarially sound principle for their state. If you don't do that, remember, this is what the Affordable Care Act did, and this is why it's such a failure, right? If you don't do that, then you are going to end up with a single payer because insurance companies are not, and again, did my explanation, it's not as simple as it sounds, right? The cost was here. They said, okay, this is the average of 5 to 1 nationwide. Let's make it 3 to 1. This is going to go over here. So the expense for older people is going to go down. That's not what happened. What happened is the expense for younger people went up. None of them sign up. And so the market, the risk pool of the entire market leans older and sicker. Listen, I'm 55, so I'm in the older, sicker group. Okay, I've had heart stents and all kinds of stuff. So I'm just telling you, what happens is it skews the whole thing. Young people won't sign up, and then it's a vicious cycle, because as young people don't sign up, the pool is more risky. The insurance companies have to raise the premiums for everybody to cover it, and that's what happens. And so in a free market economy, which is what we're in, this is how the market reacted to it, right? Now you could say, like Sanders, well, that's fine. Just tell the insurance companies, mandate the insurance companies can't do that. Then the whole thing falls apart, and we're all going to be on Medicaid. That's what will happen. So look, I'm fundamentally with you, but this is why it's so, when you say let's repeal the Affordable Care Act, this is why it's more difficult than you think, right? And so here's the thing: in just as an isolated issue, if that's all you did, I would agree with you. You don't want to do that, right? But that's why you have to add all kinds of other reforms in the system, like expanding health savings accounts and doing other things that gets premiums down. Yeah, in isolation, if you leave everything the same and you allow companies to charge, but does that make sense? Yeah. Again, that's all pre-Medicare. Anybody here on Medicare, it's not applicable. But if you want to create a free marketplace, you have to have confidence in the free market. Not saying that before the Affordable Care Act, we had problems with high premiums, insurance companies are making all kinds of money and all that, and I'm a capitalist, I'm for making money, except for if my constituents, and I said this actually, and got quoted in the New York Times on this, is, that some areas of the healthcare, like hospitals and stuff, are doing great, but my constituents aren't doing very well. See what I'm saying? So there are limits. I agree with you. I mean, that's what pre-ACA, that's what we had. We had a situation where, where people couldn't afford health coverage and costs were going up. But if you just, so if you just repeal and change that in the Affordable Care Act, this age band thing, and that's the only thing you did, I would agree with you that but you got to take this in a larger context of all the other things that are in the law that help get the cost of health insurance down for everybody, not just particular. Yeah.
I understand what you're saying. I have concerns in a different area.
Yeah.
From a very practical standpoint. It's impossible for me to go into a drugstore and find out what the retail price of a given drug is.
Yeah, let me just say we're working on that, and drug prices are a big issue, and you're right. There's no transparency in it, and I'm personally working on this issue. I've met with all the players, including the CEO of Lilly and everybody. We're working on that. You're exactly right. You can't.
I've spent days trying to research what's going on.
Yep.
And there's kickbacks all over the place.
They're rebates. They're not.
Right, from the manufacturers of the drugs, from the wholesale dealers, then on down to the insurance companies. And when I have insurance, I'll not mention I'm tempted to, but I won't, the company, it's a major company.
Mm-hmm.
When I go into the drugstore, I cannot find what the retail price of that is until I give them my prescription.
He's spot on exactly what he's saying, and that's why more price transparency is a big issue for me. We're trying to sort that out. The consumers in healthcare, it's not only in drug prices, but it's healthcare in general, don't have access to what healthcare actually costs, and that's a big problem with that. So on the drug situation, I can just tell you that everybody is looking at how to solve this problem.
No.
One of the ways is transparency. It just has to be, everybody needs to know what the costs are publicly.
Sir,
I agree with you.
the other point is controlling the kickbacks. That's bribery.
Yeah, it's called rebates. It's when there's a group of people called pharmacy benefit managers, PBMs, Google PBMs, and you'll see what I mean. It's like Express Scripts and some others, and they are the middle person and engaged in negotiating prices. And that what happened is about 20 years ago, they used to just give, say for example, a big drug company goes to a big insurance company and says, here's what we're willing to sell our drugs to your clients, our insurance company, okay? And what they would do is, because if an insurance company had a lot of covered lives, a lot of people on that insurance, they would say, hey, you got so many people, we're gonna give you a big discount, right? So if you've got 20,000 people, insurance company X, insurance company Y only has 500 people, who's gonna get the best price? Right? The one that has 10,000 people, not 500. That's the way business works in a lot of areas, not just healthcare. But there was a lawsuit that said, well, that's illegal, you can't do that because on drugs. And so what they do now is they give what are called, they get rebates. So it's not technically, it's not a discount, but they sell the drug to the insurance company, to those, through that insurance company. And then they get, on the back end, they get a rebate. So we're looking at that. The PBMs, the pharmacy benefit manager situation is one is a problem. I mean, you're spot on. We're trying to get the drug prices down. I mean, I met with the lady that runs, remember the EpiPen situation? I don't know if you followed that or not, where it went so high up in price. It's a shot that you need if you have an allergic reaction. And Mylan is the company. And so they've been in my office, and I mean, all the insurance people, the drug companies, and I've asked all those people, including the new CEO of Lilly, if they've got ideas on how to get drug prices down, they need to help me help them, right? They need to say, okay, this is what we're going to do to get drug prices down. Because if they don't, okay, and again, I'm a free market guy, as most of us in here are, right? But even with that, again, healthcare is a little different. If they can't work with us to get drug prices down, Congress, I don't know what's going to happen, but it's likely something will happen in Congress that they don't like. I'm not saying I'll spearhead it, but it's one of these tipping point things. Drug prices are such a huge issue, and they're so expensive, that unless they get on board to help us get these prices down for everybody, where people can afford their medicines, Congress is going to do something. This is a front burner issue. I'm glad you brought it up. So, right behind you.
I got two questions. One is, the bill that was proposed by the Republicans on health care, was it the start of a repeal of Obamacare, or was it basically a modification of it, taking away the bad things from a budgetary standpoint?
No, well, you repeal all the bad things that you could repeal under the budget reconciliation.
Was it the desire then to repeal the rest of it later on?
Right, under the desire is, because we need 60 votes in the Senate, is to, once our colleagues on the other side of the aisle say, they just repealed all the taxes, they just repealed all these other things, the writing's pretty much on the wall, and, do things like insurance across state lines. There's a lot of reform things you can't do under reconciliation. We need 60 votes. So that's exactly what the plan was, is to keep moving and say, look, snowball rolling down the hill, you can either step in front of it, my Democrat colleagues in the Senate, and get run over, or you can help, or you can get on board and realize that the Affordable Care Act is not going to, we're going to have most of it repealed, and we can win enough senators to get 60 votes and then move forward on the rest of it. That's right.
Second question. As a citizen, this was my impression when this whole health care deal was brought up in Congress. And I'm a lifelong active Republican and a conservative. And I've always respected Speaker Paul Ryan.
Yep.
But the whole thing at least gave me the impression that there's a real lack of leadership in the Republican delegation in Congress.
Yeah, that's not true.
Because, I mean,
The reason you have that impression is because Sean Hannity and others like him have said so. No, I'm just saying the bigger picture.
why wasn't this Freedom Caucus part of the,
They were. That's the sad part. Let me tell you.
well, then why did they turn it down?
Let me tell you the process, okay? Well, I'm gonna answer that. For the last 6 years since the Affordable Care Act was passed, Republicans, including myself, have been working on health care. Tom Price, who's the current Secretary of Health and Human Services, has had a bill to repeal and replace Obamacare for the last 8 years. Well, he put something before Obamacare as an alternative to Obamacare, and then after that, replaced it. Many of the Freedom Caucus people were co-sponsors of his legislation. I have been, not perfect, but it was basically where we are today. So, beginning last year, because it was obviously an election year, Speaker Ryan and the other leadership and healthcare people like me, over the course of the year said, okay, we're going to craft, we may win this election. And what are we going to do if we win? Okay, it's like the dog chasing the car, right? Well, we wanted to have a solution when we caught the car. So we had meetings all last year on health care. House Republicans with now Secretary Price, Dr. Price, because he was chairman of the Budget Committee at the time. Chairman of the two other major committees, Ways and Means and Energy and Commerce. I'm on Energy and Commerce, so my chairman was there. As well as leadership. All year, getting ideas, anybody that wanted to participate to craft a health care replacement bill if we won the election, okay? For 6 years of work with multiple bills, and then last year specifically sitting down with anybody Republicans that wanted to participate, and ideas, what do you think should be in there, all of that, okay? And I can tell you that most of the Freedom Caucus guys didn't come. All last year.
I guess.
Let me finish. And so this thing that they come out with, that they said, this got sprung on us, leadership again, backroom deals, crafting is total bullshit. Okay? And you can tell I'm passionate about this. It's total bullshit. These guys have had the opportunity to participate for years, and all last year specifically. And they sat back because they don't vote for anything. They've been, some of these, there's about 5 or 6 of them that no matter what you do, they create a narrative that's against it. And so the reality is the people I quit watching Hannity because he's a liar. He doesn't know what he's talking about, and he's lying to you because these people have a narrative they want to keep. And you know why? Because they're raising a lot of money off of it. They send out fundraising emails, Club for Growth, and some of these organizations, they're raising all this money so that they can do this. And the reality is that they had the opportunity to participate for years, and specifically last year. And then every member, I can't tell you how many times people have the opportunity to participate. And we changed things because of people's ideas. We changed things because of some of the Freedom Caucus guys saying, hey, we can't quite get there. You can, I'm not speaking for President Trump, but I know people that were in the room with President Trump, okay? And he said they're negotiating in bad faith. He's never negotiated with people like these people. He sat down with them multiple times in the Oval Office. Said, okay, let's see what if we can tweak this a little bit and still meet reconciliation so we don't need 60 votes. And so he tweaks something, then he tweaks something, and they just keep moving the goalposts until they don't get there. That's what happened. I mean, I'm, as a healthcare provider, I'm on the committee of jurisdiction, and I'm intimately involved in this, and I'm just telling you that's what happened. And why, I don't know. Because in my mind, it's not keeping the promise that they made to all their constituents to repeal and replace Obamacare. And if you put stuff in the House bill that can't meet this reconciliation process in the Senate, it's dead. So I mean, I could come out here and tell you that hey, Congressman Bucshon we should have added all this stuff in there. It's not a full repeal. It doesn't do this. It doesn't do that. And pounded my chest and said, I'm a true conservative, and I can't believe that the Republicans are doing this. And I'd be lying to you. Because what's going to happen is my promise that I made to repeal and replace Obamacare is not going to happen if I take that approach. because it's not gonna get through the Senate, and I would know that, you see, and I'd be not telling you that. See, that's where I'm coming from.
I guess, to me, when I compare now with when Nancy Pelosi was Speaker of the House, and I think she's probably the poorest excuse for a public servant, let alone a congressional member, I've ever seen in my life. But somehow she was able to get the whole Democrat
Yeah. You know why I think that
in
is?
Congress to pass that stupid health care
I
act.
know.
And now Republicans are in control, and the whole thing, I mean, it made to the common citizen, it made the Republican leadership in Congress look terrible.
It did, and the president looked horrible.
And that's where I
And
get
so-
the impression there's a real lack of leadership.
That's just not true. I tell you, that's Friday when Speaker Ryan pulled all of us into a room in the Capitol building and said, we don't have the votes. We're gonna pull the vote out. I was probably the most upset and maddest I've ever been in Congress in 6 years. And so many other people were too, because success was right there. And we had about 20 members of our conference that just said, nope, not enough. Nope. And then guess what all of them did? They all ran out and sent fundraising emails, and they all jumped on conservative talk radio and everywhere and said that people like me and Speaker Ryan and everybody are these, we're not telling you what we can do. Research it for yourself, the reconciliation process. Don't take my word for it. It's budget reconciliation. If you want to get anything with simple majority, it has to have a direct budget impact. If you put something there, I'm going to get to you, see guys. If you put something in there that doesn't, it goes to the Senate. Schumer stands up and goes, I hold a point of order against this legislation. There's a non-budgetary issue in this. And they rule, the parliamentarian agrees, and it kills it. And not only does it kill it temporarily, you only get one budget reconciliation chance every budget. So we're trying to do this with the 2017 budget reconciliation, with the 2018 budget, which we're getting ready to do. We're trying to do tax reform. So if it gets killed in the Senate, this 2017 budget reconciliation is permanently dead. You can't go back to the House and change it. It's dead. And so what that would do is put us in a position where we then we got the 2018 budget reconciliation. We have to do this because we can't get Democrats to vote for this stuff. Then we're going to do health care with that, then what are we going to do tax reform with? See what I'm saying? It's a very frustrating situation. So I'm doing the best I can on this. I mean, and I think we might get there. We'll see when we get back Tuesday, because I think some of the Freedom Caucus guys, look, I know all these guys personally very well. So I think you were next, and then you.
Okay, so I just want to try and make sure I'm following not to get too far into the weeds.
Yeah.
Follow the process. And make sure this is still kind of the working plan going forward. There was 3 parts, correct? There was part 1, which was to use the reconciliation.
Right.
We only get one shot.
And repeal as much as we can and replace as much as we can. Right.
That, you could get that through. And then part 2 was effectively where Secretary Price will avail himself of his 1,400 plus
Correct.
opportunities.
And that's ongoing, by the way, even during our.
Yeah, that is independent of anything.
Correct.
That happens in Congress.
That's correct.
And then part 3 was non-budgetary, but still really good common sense things like
Correct.
buying across state lines, tort reform.
Correct.
But since those do not impact the federal budget in any way, you still have.
You have to have 60
effectively
votes.
2 options. You have to fire enough Democrat senators.
Which we're going to try to do at 18, right? Here, especially here in our own state. We all got to really work hard on that. It is a big issue. Thanks for bringing that up.
It's important to fire them on general principle, but
Yeah.
if we can't, the other thing would be finish what we started with Gorsuch,
Yeah.
as I understand it, and then just
They could do that.
Kill it.
That's correct. Senate rules. Here's the thing on that one, House Senators like me have literally been begging them to change the Senate rules. Please help us. But I can tell you, you'd be surprised, it's across the Republican Party. You would think, well, people want to blame Mitch McConnell, right? But for example, Ted Cruz is against changing the rules for legislation. Other people are. So it's more of a, not necessarily, you know, where you are on the Republican spectrum. It's if you're a senator, they just feel like, for example, and the reason they feel this way, I would change the rules tomorrow, repeal the whole damn thing and replace it. That's what I would do. It's up to me. But the thing is, they say, well, if we didn't have the 60 vote thing when Obama had control of the House and Senate, we'd have cap and trade, we'd have all these things, and and that's true, they blocked it because the Democrats didn't have 60 votes. And that's their rationale. I don't agree with it, but that's the rationale. That's the situation. It's frustrating.
It is, I'm just kind of curious with the phase 3 part of it, the non-budgetary items. Are there any other ones that I'm missing out on?
There's a whole boatload of stuff. I don't have a list on me, but a lot of stuff in the law that's there that, yeah.
Okay.
There's a whole laundry list of things. Again, I don't have the list in front of me, but the basic premise of it was, okay, if they're not going to change the Senate rules, then once our Democrat friends see that we've repealed almost all the budgetary stuff, including all the tax, remember, $1 trillion in taxes on the American people over the next 10 years. Medicaid reform in a way like we've done in Indiana, even letting it go even further to make it a better program, more fiscally sound. We figure that they see that happening, they see what Secretary Price is doing, and how are they going to explain, well, they're going to vote against insurance across state lines to get premiums. It'd be a tough vote to say no on some of these other things when you're that far along. That's the premise.
Okay, as I understand it, we need to do the healthcare first to get the savings back on the books, as it were, in order to go on to the tax reforms.
Yeah, you don't have to, because but what it does is it takes $1 trillion out of the tax baseline and it makes it. I'm not a tax guy, but basically it takes $1 trillion in taxes over the next 10 years, which is the budget window Congress deals with. And so that makes it much easier because it changes the baseline tax structure to get to change the tax rates and get things done better. We can still do tax reform, but we're just going to have, it's just going to be different because of the lack of changing the tax baseline, basically. Yeah.
Okay. One thing that Mr. Winter brought up was about the leadership.
Yeah.
The election wasn't that long, and I watched the debate.
Yeah.
And they wanted Trump to sign the agreement that he would support whoever was elected, and he did. But yet, whenever he got elected, the ones that forced him to sign it would not support him.
I know.
Okay, and then the only one that's national prominent Republican that stood by him from the get-go all the way through was Jeff Sessions, not Paul Ryan.
Yeah.
That's where he's coming from. Paul Ryan has not showed leadership until just recently.
Well,
that's the way we see it here
understood.
in the Midwest.
Totally understand. Let me
Now,
go ahead. Finish. Go ahead.
Does anything? I'm in business.
Yeah.
Been in business 39 years. And keep talking about the price of insurance, but what drives the price of insurance up?
The cost of health care.
It's a cost of health care. Why can people go to Canada and get prescriptions a hell of a lot cheaper? Why should they buy them right up here from Indianapolis? There's something wrong here. And my question is, does it have anything to do with the American Medical Association paying millions of dollars to the National Republican Party and paying millions of dollars to the Democrat Party? That's been going on for years. And that money goes into Republican war chest for guys like you.
They actually,
United States,
the AMA actually supports Democrats, not the Republicans. Believe it or not, they endorsed the Affordable Care Act. So, and the thing is I'll be brief on from my perspective on campaign contributions. Okay, people contribute to your campaign if they already fundamentally agree with you overall. That's been my experience. I've not got a single donation from the Sierra Club, right? Not one. They hate me. I have a 0 rating with them or something. So I just want to say out front, the money in politics is a problem, the vast amount of it, but in general, for individual people like me, people that contribute to support me, and if you have in this room, I greatly appreciate that, because they fundamentally already agree with what I'm going to do when I get there. It's people that are, it doesn't influence me at all. If you give me money and you don't give me money, I don't care. I try to do what I think is the right thing. Okay, that's one thing. Now I'm going to defend Paul Ryan for this reason. First of all, I know him personally. I know him very well. He's a great guy. He's a small town guy from Janesville, Wisconsin. If he came in here, he would fit in this room like perfectly. I mean, he's just a regular guy from southern Wisconsin. But he had a different role in the election as Speaker of the House, because remember, in a presidential year, favors Democrats. It just does, historically. The presidential year, the turnout model favors Democrat candidates across the country. So you're looking at an election where, we have a bunch of members of Congress who are in swing districts. I'm not one of them, but a bunch of my colleagues that are what I call the majority makers. We have to have these people win. There's about 20, 25 of them that are in districts that Democrats win, but they win because they're a good candidate, right? And look, I supported Trump because he's our nominee. I always support our nominee. I don't care what the media says. I'm a Republican. I support Trump. In those districts, though, okay, it could be a little tough. Now, almost all of them supported Trump, right? Just didn't wear it on their sleeve because he's the nominee. So Speaker Ryan is the face of the House Republicans, okay? So he has to ride a fine line for all of his members. Pretty easy. Ryan could come out and campaign with Trump, and it'd be great for me. But it would suck for some of my colleagues in Northern Virginia and my colleague in Maine, Bruce Paulkin, because they would run ads against these folks. And what like the left did, right? Oh, Trump's an extremist, he's this, he's that. And it could really hurt their election chances. So Speaker Ryan just had a different role as the leader and the Speaker of the House. And what he tried to do is ride a fine line of being supportive behind the scenes of our nominee, which he was, but not wearing it out on his sleeve to where all my colleagues in these different districts get tagged with it and potentially lose, and we could lose the majority. Now, as it turns out, hindsight's 20/20, right? As it turns out, Trump had big coattails for almost everybody across the country, right? But if you look at historically in elections like this, presidential election cycle, Secretary Clinton, who everybody knows, Trump, I'm just saying from an overall perspective. Trump, who's really was a wild card candidate, not for me, but for the public. You see it out in the public and the news media, right? You could see where that could turn into a disaster for House Republicans, and we could lose 30 or 40 seats and lose the majority. So Speaker Ryan, I'm defending him because I think he did the right thing. I think he supported the nominee behind the scenes. He met with this is the thing you don't see, but he didn't wear it out on his sleeve publicly because he was trying to make sure that House Republicans kept the majority. And then you saw once I got you next. Once obviously we win, Speaker Ryan's doing right on the team, and with the president. So that's my perspective. He just had a different role, And again, who would have thunk it, right? I was telling these guys at tape, somebody, that Kelly Ayotte, our Senate candidate, up in Vermont, New Hampshire. I always get those two confused. So New Hampshire, she made the political calculation. Look, if I don't, I'm going to come out and I'm not supporting Trump. He said this, he said that, and all this, and I'm in this swing state and all that, that's what got her beat in retrospect. Right? Hindsight, you look at hindsight, the reason she lost is because a lot of Republican-based Trump voters wouldn't vote for her. And but who would have known that, right? Who would have thunk that? I mean, Joe Heck in Nevada, a colleague of mine, came in with me. We lost that race out there to replace Harry Reid. I think probably maybe for the same reason. And Nevada has a big libertarian slant. I don't know if you know that. So, but even so, Joe was like, no, I don't support Trump. The two senators, Republicans, that came out and didn't support Trump, both lost. The rest of them won easily. All these senators are going to lose their elections. Portman and all those, and up in Wisconsin, Ron Johnson. Who thought Ron Johnson would win Wisconsin like he did? Everybody thought, hey, Feingold used to be a senator. It's a done deal. Turns out Ron Johnson and these others had the guts to say, look, he's the Republican nominee. And of course I support the nominee, and they won. Yeah.
I have a different kind of concern, just in general with the healthcare.
Yeah.
And my overall concern is how much closer would having federal regulated health insurance push us towards socialism?
A lot closer. And let me tell you that here's why it won't work. Because Bernie Sanders, for example, says Medicare for all. Okay? First of all, let me just tell you, based on the demographics, the Medicare program has some challenges right now because we just have the baby boomers, right? It's not my opinion. And the other thing is, as I said this to the crowd, we were in Posey County and I did one of these, it was a town hall type thing. It's like this, except it wasn't this type of crowd, if you know what I mean. Right? In fact, it was just the other opposite. This was in Posey County, a month ago or so. And that's what they said. How come single payer? Anybody watch my Facebook town hall? I got asked, I think, how many questions were single payer?
Yeah, you probably have 100.
Nick's my communications director, by the way, from DC, and he was the one, if you watched him, he was the moderator. Somebody asked us, who's the moderator, because they knew Nick or something. But he was looking, tons of people were asking, single payer, right? I'm telling you, it won't work. And my first response down in Posey County was, okay, raise your hand in this room if you think the federal government runs any big program like this and does it well. Not even the left crowd never raised their hand, okay? I mean, the defense rests the case. Okay? If you don't have, and I'm not saying what we have now is good because it's challenging, right? If you don't have a robust private sector health insurance marketplace out there, in addition to good programs that we need, like Medicare, Medicaid, and the other two are the VA and the Native American healthcare system. That's what the government runs. The government already pays for like 55–60% of healthcare in the United States already. But if you don't have a robust private sector marketplace, it's going to be a disaster because the government's going to have to make decisions based on money, on cost. I would argue every other country in the world that has this type of system in some form rations. Okay? They just do. Canadian system rations. They only have a certain amount of money they'll pay out for heart surgery every year, and you get to that point, you gotta wait for the next budget year. That's why tens of thousands of Canadians come to the United States for health care. Tens of thousands. Because otherwise they're stuck. The other thing it creates is, in my opinion, which is morally a problem for me, is a distinct two-tier healthcare system. Because private insurance would unless you outlawed it, would still be most probably available, which it is in England, for example. 10 or 15% of their citizens, I know this, I was just talking with one of the people from Parliament last fall. They're wealthy, and they buy private insurance. So 10 or 15% of the population, they just buy private insurance. And if they need their surgery done, they just go get it done like you would here in the United States. They get on the schedule and they get it done. The rest of the people might wait 6 or 8 months to get their surgery done. I mean, is anybody in here, as a physician, I would have a hard time seeing two patients right in a row, see patients right in a row and say, hey, next week we're going to take care of this. And the next one say, well, look at my calendar for 8 months from now. Does anybody have a problem with that other than, I mean, that's a problem, right? I mean, morally and ethically. So we don't want, in my opinion, it won't work. Number one, it's gonna run out of money if you do it. Number two, it'll create a two-tiered system where, depending on, who you are, you'll be treated differently. Which people would argue now, well, people that are uninsured are in that situation now, but they're really not, because if they're forced to go to the emergency room, but once they do, they get the same healthcare approach that anybody else would. But it just, look at the VA right now. That's the other thing I always say. Look at the VA system. And I know the VA well. I spent about 2.5 years in the Milwaukee VA out of my 7 years of training. I love the VA for what it does, but it needs major reforms because you see what's happening with our veterans, right? That's the way it would be for everybody. I mean, it's just not going to work. And it was your next, Rick. And then and the other thing the thing about it is do we really want the sole person that touches every single citizen in our country because it's health care? Do we want the federal government to have their finger on that? Just the feds? I don't. But don't get me wrong, I'm not saying that the system, the way we pay for it now is good. It's got a lot of problems. There's people uninsured. There's people that can't afford premiums. But you pointed out, I think you were the one who pointed out, that's why I'm working on the cost of healthcare itself, the product, and price transparency. Somebody here, we were talking about transparency in the drug marketplace. You were talking about that. The only way to get a handle on all of this stuff is get the cost of healthcare itself down. Because what we're doing right now is we're chasing paying for a product, right? And we're chasing our tail, because as we continue to try to figure out how to insure people to pay the bills, the cost of the product you're paying for is doing this. And obviously we haven't been able to catch up, right, in a long time. And we're not going to until the consumers know what things cost. Everything out there is transparent across the healthcare system, so people know it. I mean, I had the CEO of IU Health in my office the other day, talking about this, about hospital not-for-profits that have huge profits and what they're doing with their money. I had off the internet the IU Health System's, expenses, revenue, difference, profit. I've been trying to criticize them, just saying, okay, you're a not-for-profit hospital, and in 2014, you had, I think it was $300 million in profit. What'd you do with it? And the only way that we fix that problem is it has to see the light of day. We all have, you can go on some website, this is all public, you can do this. They're not for profit, you can find the financial information if you want, but it's just not easy. And so that's what we got to do. We got to get the system where we get the hot costs down. LASIK eye surgery, plastic surgery, things that are paid for by us, not paid for by insurance companies. The marketplace sets the price. Right? LASIK eye surgery 15 years ago, $4,500. Almost nobody could afford it. It became clear it was a really good thing. Guess what happened? Now 15 years later, you can probably get both your eyes done for $600-700. The equipment's better, the doctors are better, and the price is way down. Why is that? Because it's consumer-driven healthcare. The consumer knows it's a good product, and they go, yeah, I think I'm going to Dr. X over here because, and as over time, and then that will balance out, and the marketplace will balance out. But the linchpin is the consumer has to know. Rick?
I think you answered my question, because my question is going to be, how do we control healthcare costs?
I think there's a multitude of things we have to do. One we can't do is price fix it which is basically where it is now, or further price fix, or further take it over with the governments. I think my personal view, that's a bad approach. The only way is, in my view, is all of this information has to be easily accessible to the consumer. When you go to a hospital, and I know this because I was the head of cardiac surgery at St. Mary's, I went to him one time and said, how much profit do you make on the cardiovascular line, which means cardiology, cardiac surgery, and everything that we do? And they wouldn't tell me. I'm the head of the department. I kind of find out through my contacts, my grapevine, they were making about $30 or $40 million a year off of it. And that was, you know, in there. I'm all for profit, don't get me wrong, within reason. Like I said, if all of us in here had insurance that was low cost and we could afford it, I'd be applauding. Yay, you made $300 million last year in hospital. That's fine. But in a situation where 25 million people are uninsured, people can't afford their deductibles or their premiums, and it's getting worse, that's a problem. But how do you fix that in a free marketplace? You got to have the consumers part of the equation. We have to be part of the equation. We can no longer just go in and say, I don't care what this costs because my insurance is covering it. We have to, even with the insurance covering it, we have to say, hey, hold on a minute here. You know, this MRI only costs over this over here. Why are you charging this? Yeah. And then we're going to finish up. I think. What's our debt?
It's about 8:30 right now.
Yeah. So maybe a couple more questions. And we'll stop.
I'm not gonna ask you about healthcare, so don't worry.
I could talk literally all night on that subject.
Let's use your doctor. So, one of the things that congressional Republicans, I think, presidential candidates run on all the time is term limits. Term limits, term limits that.
Some do, yes.
Have you ever thought?
There's 2 camps on that. Yeah.
Sure. Well, I'm in the term limit camp. I like to term limit our congressional representatives as well as the bureaucracy.
Sure.
Have you ever given thought to how long you'll serve in Congress, or that if you'll move on?
I have actually. I think most of you, we haven't met, but I've said that this is not going to be a career for me. And I don't, you know, we'll see. It depends on what happens during this year, and I'm just looking at, you know, trying to accomplish the goals that I went there for. One is healthcare, obviously. One is taxes. The other one is to get the government out of our daily lives as much as possible. One of the things that drove me to get in is when the government bought GM and took over GM. Even though in retrospect, maybe it was the right thing to do. I mean, if you talk to the Michigan reps, they'll tell you, Republicans and Democrats. But I just thought that was precedent setting. You know, businesses, small businesses going out of business, and they picked winners and losers. That was one of the reasons. So it's not, you know, I don't know at this point, but I'm in my 4th term, and we're getting farther along on some of the reasons why I went there. Yeah, last question.
Me?
Yeah.
I just found out recently that for people on Medicare, that Medicare will only pay for colonoscopies every 10 years. And I had a friend of mine,
Yeah,
I don't know whether that's regulation or all, but I had a friend of mine, his mother,
That's
who
going to be
passed away
seen.
recently, who had a colonoscopy 6 years ago, but couldn't have another one, and she developed colon cancer and it killed her.
To be honest with you, off the top of my head, I don't know that. That wouldn't be a law, though. That would be something through the Center for Medicare and Medicaid Services.
What can we do to?
We'll check into it. Write that down, guys. We'll check on what the facts are on that.
Appreciate that.
But generally, the government follows what are the guidelines, the standard of care, you know, and on all of these things. So I don't know off the top of my head. 10 years seems like a long time. Generally, for full disclosure, my dad had colon cancer in his late 50s, so I've already had some 3 scopes in my life. You know, I've experienced the prep. If anybody in here has also done that, you know what? You'll get a big laugh. You know, I can tell you. For everybody that's laughing, they've had one. Okay. But my point is generally physicians recommend, and don't quote me on this because I'm not a GI doctor, but generally, if you've had 2 scopes 3 years apart and they're both normal, then you might be able to go out 5 years. So the 10 years seems like a long time to me, especially if you have a family history. 10 years is not.
I even heard us making doctors falsify reports so a person on Medicare can qualify for
That could be true, and it may be because Medicare is screwy. They consider it a screening exam, right? And historically, Medicare has not paid for screening exams. I'm only, you know, and that's part that could be. But 10 years.
I don't care if you get cancer or die.
No, it was all about. No, it was just historical, right? It was about data, and again, I didn't do it, right? But it's data and what the data shows. But generally they try to follow what would be considered normal practice guidelines, and 10 years is not, I can tell you. Well, I appreciate you all sitting here and listening to me give my views, and hopefully I've cleared up some things, and also hopefully you get the impression that I'm there to do what I said I was going to do. I said I campaigned for 7 years on repealing and replacing Obamacare. I'm going to do that if I get my vote. When I get a chance to vote, that's what I'm going to do, because I think it's the right thing to do. I'm going to stand up for individual liberty and freedom and get the government out of your lives as much as possible. That's what I've campaigned on, and that's what I'm going to do. And I'm going to try to get your taxes as low as possible, that still allows our government to function within the role that we're historically supposed to have. And stand up for the 10th Amendment and allow the states to do the things that the Fed shouldn't have their hands in.
And try to get us the cost of living rate.
And I say, yeah, well, the COLA, she's talking about Social Security COLA. You realize that's in the statute, that every year people say Congress didn't give us our rate, but I think you know that it's in the Social Security statute based on economic growth. So Trump, I'm hoping we'll get you your COLA increase, because under President Obama, the country was barely slugging along. And in his defense, there was initially there was a big recession, and we all know that. But then the recovery from that was the slowest in decades and decades, because of the policies of the administration, which cost you your COLA increases, your cost of living increases, what that's cost of living adjustment is what that stands for under Social Security, and that's because it's a formula based on how much the economy is growing. So I'm hopeful that you're going to get really big COLA increases, because that means the rest of our economy is really going gangbusters. Thank you, everyone.
Okay. Is anybody missing this month?
Michael Jackson.